My name is Dr. U. Grant Baldwin Jr. with Cummings Graduate Institute of Behavioral Studies. I'm the Assistant Director of Academic Programs at our fine institution. And we have a guest this evening who's a newly enrolled student in the CGI program. So we'd like to welcome Mr. William Chum, LMHC, to this discussion here. And William, tell us about your background and where you were born, where you grew up, your education credentials, and pretty much your family, your professional career.
Yeah. Thank you, Dr. Baldwin. So my name is William Chum. I am a mental health counselor and I'm licensed in the states of New York and Hawaii. I am born and raised in Honolulu, Hawaii, and I spent a few years of my childhood in Hong Kong, where my family is originally from. I earned my bachelor's in psychology at the University of Hawaii at Manoa, and I earned my master's in mental health counseling at Baruch College here in New York City.
Okay. So what, when selecting a graduate program, why did you choose the DBH program as your doctoral degree?
Yeah, so I had wanted to pursue further education post-master's for a long time. And I've done a lot of research. I've looked at different clinical psychology programs, social psychology, critical psychology. I've looked at so many of these programs. And when I finally stumbled upon the DBH program, I saw a few schools offering it. And it's a pretty new degree. And it's not something that I was very familiar with. So I did a lot of research, and the fact that it's a doctorate of behavioral health really stood out to me. And the reason why it really attracted me is because in my first year of my master's program, I was a clinical intern at Gouverneur Health's Department of Behavioral Health. And I remember asking myself the question of, why isn't this department called the Department of Mental Health or the Department of Psychology or Psychiatry? And that was really the first time I heard the term behavioral health. I asked supervisors, I did some Googling, I really tried to find that answer out. And the answer that I really came to is that behavioral health, although it encompasses mental health, it's just so much more. It encompasses all the physical, the medical, the systemic, all these other things that contribute to a person's well-being. And so knowing that really attracted to me to this DBH program, because even right now in my work, a lot of my patients come from very diverse backgrounds. And I think to approach them in a simply traditional psychology or mental health way is to do a disservice. It wouldn't be looking at them in a whole person way. And so to have a training in behavioral health, specifically in this DBH program, I believe will really help me to be a better clinician, to take a look at a person in a whole person way and help them in the ways that they really need beyond traditional mental health care.
Okay, great. What were your feelings and thoughts once you received your acceptance letter into the DBH program?
Ecstatic, excited, so happy. It's such an honor. I know that this isn't an opportunity that's extended to a lot of people. I think this is such a privilege, such an honor to be invited to this program. And so happy to be part of the CGI community.
That's wonderful. You mentioned something about work. Tell us about the population of patients that you work with as a clinician.
Yeah, so currently I'm a psychotherapist in private practice. Previously, I did have a few trainees that worked under me, but for now, ever since the pandemic, I've really pulled back, and now I'm a one-person operation. My practice is based in Woodside, Queens, and Woodside, Queens, if anyone here is familiar, is a very diverse neighborhood here in New York City. Largely immigrant, largely people of color, all sorts of backgrounds. And so right now I work with mainly adults from very diverse backgrounds.
Okay, that sounds like a very diverse area. I have to check it out a little bit more. What do you hope to achieve within the community as you serve as a future DBH?
As a future DBH, especially as an Asian American future DBH, I think it's so important that I take my identity into consideration. As an Asian American person, especially in this field of psychology, I've really come to find that there isn't a lot of representation for my community. There isn't a lot of data on Asian Americans. There isn't a lot of data on Asian American mental health. And so what I really hope to achieve through this program as a DBH is to be able to reinterpret existing data in a culturally informed way, specifically for my population, specifically for my community, and to also produce new data and new information that'll help treat Asian Americans in a way that's appropriate.
Okay, so that representation seems like was a big inspiration to you into enrolling into the program. Okay. So far as a newly enrolled student of CGI, what has surprised you while being in the program so far?
So far, maybe 4 days before starting my first class, I've had the opportunity to meet you, Dr. Baldwin. I've met Dr. Young. I've met a few other staff and faculty here, and also a few other classmates, potential classmates, in the last meet and greet. And what's really surprised me so far, pleasantly surprised me so far, is what a community this school is. Even coming into this program, I haven't really formally met anybody yet. And I've already felt so welcomed. I've already felt like my ideas are going to be valued. And that's something I'm really excited to be a part of.
So what can someone expect when they enroll in CGI, you think?
I think someone can expect that they should show up as themselves. I think someone should expect that they should bring who they truly are into this program and be able to expect that they're going to be able to contribute who they are and their ideas and sort of bounce things off each other and be able to do things for this field as a whole.
Okay. Do you have any words of wisdom or advice to share with future DBH students?
My advice is always to just be who you are. I think that's something that I've really learned over the past years. I think that's something I've really learned over my career, especially as I was the only Asian man in my master's program, in my graduate program. The advice that I would give is to show up as yourself, is to just be who you are, not try to be who you think people want you to be. Because when you are who you are and when you show up as who you are, you represent the people who look like you, and represent the people who are going to really value from you just being you.
Wonderful, wonderful. Is there anyone you would like to thank for supporting you in this endeavor that only 1.1% of the world's population engages?
Yeah, such an honor. I have so many people to thank. I think, first of all, I want to thank all the patients that I've ever worked with. I doubt they'll watch this video. I hope they don't watch this video, but I would like to thank all the patients I've ever worked with, because I think I've learned so much from them, as well as any other formal training I've ever had. I think all the patients that have invited me into their lives are a big part of my journey as a clinician. I'd like to thank my parents, who have always been so supportive and have worked so hard to give me the opportunities to go after what I wanted to go after. And I'd like to thank my partner, Alec, for always supporting me and motivating me to do better. And thank you, Dr. Baldwin, for making time and creating this space for me to share my story.
Well, your story is great. You have a rich background, and with your educational, cultural experience and an array of other experiences, I'm quite sure that you will educate us all in the program. So we're both learners, eternal learners here and everything. And I think you're going to bring a lot to this program and a very unique scope to this program. So I look forward to your matriculation in this program and seeing you grow. I think you're going to be a great asset to the CGI community as a future DBH. And I would like to thank you for making the time this evening to, share with us your experiences and provide an opportunity for us to get to learn more about you than what we at CGI already knew. So I thank you for this, and your classes are starting in a few days. So I know you're gearing up and getting ready for that. So
I'm excited, and I'm already so proud to be part of the CGI community.
and we're proud of you. So we would like to say thank you for coming and sharing, and we would like to say to be continued. I'm quite sure we'll talk with William some more out of the next semesters to come, with sharing his experience and his uniqueness and what he's bringing to the program and what he's learning from the program. So thank everybody for showing to tonight's display of student and teacher administrative perspectives, and we would like to say good night or good morning to wherever you are. Take care.